Uh, Hello friends, myself Yes Bakhtaria from the class third year PPT. Today's my topic is the classification of the myasthenia gravis from the subject neurology. First of all, the definition. Myasthenia gravis is the chronic autoimmune neuromuscular disorder characterized by the weakness and fatigability of the skeletal muscles due to impaired transmission at the neuromuscular junction. Now we will see the classification of the myasthenia gravis. The most commonly used classification is the Myasthenia Gravis Foundation of America (MGFA) clinical classification, and the class 1 ocular myasthenia gravis. The features of the class 1 ocular myasthenia gravis are weakness limited to the extraocular muscles, ptosis means the drooping of the eyelid, diplopia, double vision, no limb, bulbar or respiratory muscle involvement. Examples: a patient present only with the drooling, drooping eyelid and double vision. The second classification of the myasthenia gravis is the class 2 mild generalized myasthenia gravis. The weakness affected muscle other than the ocular muscle. And the class 2A, the mild weakness of the limb and axial muscles may have mild ocular weakness. Bulbar and respiratory muscles are minimally affected. Clinical features of the class 2: difficulty climbing stairs, fatigue during the prolonged walking, mild neck weakness. And next, the class 2B, mild weakness predominantly involving bulbar muscles, respiratory muscles. And the clinical features of these are difficulty swallowing, nasal speech, mild breathing difficulties. Then class 3, moderate generalized myasthenia gravis. The class 3A, the clinical features mark fatigue during the activities, difficulty lifting the arm, difficulty rising from the chair. Class 3B, moderate weakness involving the bulbar muscles, respiratory muscles, and the clinical features of these are significantly dysphagia, slurred speech, respiratory weakness. Class 4, severe generalized myasthenia gravis. Class 4A, severe weakness mainly affecting the limb and the axial muscles. The clinical features of these are unable to perform the routine activities independently. Severe limb weakness. Class 4B, severe bulbar and respiratory involvement. The clinical features are severe dysphagia, respiratory distress. The class 5 and the last, the myasthenia crisis, features the life-threatening stage, requires the intubation and mechanical ventilation due to the respiratory failure. Clinical features of these are severe respiratory muscle weakness and inability to maintain airway emergency conditions. Thank you.